Prostate cancer is one of the most common cancers affecting men worldwide. A diagnosis that often brings with it fear, difficult decisions and life-altering treatments. But now, a breakthrough technology is offering new hope. It's called HIFU, High Intensity Focused Ultrasound, and it's changing the way doctors approach prostate cancer. Unlike traditional surgery or radiation, HIFU is non-invasive, precise and minimizes damage to healthy tissue. For many men, that means fewer side effects, faster recovery and a better quality of life. As awareness grows and access expands, this cutting-edge treatment is sparking new conversations about how we fight cancer and how we care for those who face it. It is not a disease of the old anymore. Largely seen in older men, prostate cancer is now being seen in men even below the age of 55. Cases are rising sharply in India. Urban men above 60, of course, continue to be the most vulnerable. Once considered rare in India, prostate cancer is now among the top 10 cancers affecting men. 48,000 new cases expected in the year 2025 this year. The numbers are climbing very fast. Urbanization, longer life expectancy and sedentary lifestyles are contributing to the surge, but so is increased awareness and screening, especially in cities. And joining us right now is Dr. Yuvaraja TB, Uro-Oncology Surgeon from Kokilaben Dhirubhai Ambani Hospital. Thank you for your time. I want to ask you that there is great amount of concern regarding increase in cancer cases, prostate cancer cases in our country. What could be the possible reasons, doctor, behind this?
Reason generally it has been blamed are the urbanization. That is the most important one. So now in Western countries, the incidence is almost 200 per lakh population. In India is around 20 lakh per population. Although incidence is less, the population in India is very high. So the number of cases remains almost the same. And now because of the awareness among people to do health checkup, and they are doing early detection and screening of by doing a simple blood test called PSA test. So we can detect early cancer. So that is the reason we are seeing more and more cases.
Traditional surgery or radiation often come with serious side effects like incontinence or impotence. But now, a new frontier in treatment, HIFU or high intensity focused ultrasound, has come in. It is non-invasive outpatient procedure that uses focused sound waves to destroy cancer cells without cutting or radiation. Mehta, co-founder NovoMed Incorporation, is now joining us. Thank you for your time. We want to understand what is this technology, how is it disruptive? Explain to us firstly, how does it really work?
To put it simply, to understand the concept, it is like when we were all in school and we used to use a magnifying glass and put it out in the sun and to burn a spot on a leaf, something similar to that. So the sun's rays are harmless, but when they are focused in a particular point, that energy creates that burn. So HIFU works in a similar manner where you are using sound waves, and when focused, they can create that burn, which you want to burn the tissue, very systematically and very precisely without harming anything around it.
HIFU is FDA approved and now available in top Indian hospitals. Experts say it is ideal for early stage localized prostate cancer, especially for patients unfit for surgery. So why is that HIFU is really considered a better line of treatment in that sense?
The main points of HIFU where it kind of separates itself from the traditional treatments, especially for the low-grade cancers, is that it's very safe and effective. So when we are looking at options like surgery and radiation, the side effects that can occur because of the procedure itself are very high. So when I talk about side effects like incontinence and sexual function. So when we look at HIFU, the chances of these side effects are close to zero, I can say.
So doctor, how does HIFU really work better, given that you did mention that prostate cancer is being seen in the younger population as well?
It is not better than that. It is equal to that in select cases where, so there is a very small prostate cancer inside the prostate, volume is less. So no need to do a aggressive therapy like surgery and radiation, which is a invasive and it has got a lot of side effects. So preventing this, still we can treat the cancer. So without compromising on the survival of the patient by using these ultrasound waves. So in a high energy, which causes heat energy and destroy the cancer cells.
But HIFU isn't yet widely accessible. It's expensive and available mostly in metro cities. Doctors stress the need for early detection, better infrastructure and awareness, especially in Tier 2 and rural areas. Talk to us about the disadvantages of this new technology. High recurrence rates, I understand, is one of them. Also that this isn't for everyone. HIFU really isn't for every patient of prostate cancer, isn't it?
So now HIFU is not for everyone. Like surgery is also not for everyone, and radiation is also not for everyone. So we always select the patient. Which patients are selected for HIFU? The HIFU, we divide them into low risk and intermediate risk. Means so low risk or intermediate risk means there is a small cancer, only one side of the prostate. Volume is less than say around 3 cc, 4 cc. So then only these people are suitable. If there is a cancer in the entire prostate gland, this treatment cannot be done.
Now, if cancer recurs after HIFU, patients can still undergo other treatments like surgery or radiation. This is a significant benefit over some other therapies which can limit future options.